Yeah, we'll close at 5:30. Get my chair, Stevie.
That's my chair,
Perfect.
but I think it's your chair.
It's definitely not.
Recording in progress.
But it definitely needs some WD. Is everybody ready for me to call it to order? Okay, so it's 5:30 and I will call this meeting of Weston County Health Services to order. Mayor, do we have a quorum? Yes, we do. Corinne, do you want to lead the pledge of allegiance there? Ben, are you up to the frame? Oh, absolutely. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord Jesus, we thank you so much for what is this place that we live and for this hospital that we have in this community. We thank you for so much the blessings that we have for daily, for the many different things we're doing here. And Lord, we ask that you be with our time that we spend right now. Give us wisdom, give us teamwork, give us strength, and guide us through this time. In your name I pray, Lord Jesus Christ. Amen.
Visitor comments?
Me, I guess. Well,
Yes, you have any
I tell you, I just got a few answers that I'd like to answer, have answered. And a while back, or about a year ago, I got run over with my truck at the gravel pit. And they called the ambulance and they come to town. And I was in there, and I was all right as far as I'm concerned. And the lady come in there, I don't know who it was, and she said, I called the bird, the helicopter. And I said, no, I said, I'll go over to Rapid City with the ambulance. Well, here comes the bird. And I had to go with the bird. And I'll tell you, it was $80-some thousand. And I said, that's enough of that crap. And I could have went over. Now there was probably bleeding to death or a death deal, yes. But that wasn't a death deal. And then I got to Rapid and I got it and I took care of myself. And I was in the hospital for a month and I told them they couldn't get my blood pressure down. And I said, you guys, I said, you don't listen to me. I said, I just need potassium. And when I get sick or something like that, I take potassium and it gets me right going. Well, they wouldn't give me none. So when my wife come over, I said, bring me some potassium, I'll be all right. Well, in the meantime, there was people trying to get me in this place out there and they wouldn't take me. They said they had room, but they wouldn't take me. And I was pissed off. And I'll tell you what, I had to go to Denver or Hot Springs. And I'll tell you what, my wife had to drive through Denver all the month. And that really pissed me off. And I tell you what, as far as I'm concerned, I wish if I had my choice and my money goes to as a taxpayer, and I pay a hell of a lot of taxes, then I'll tell you what, I would give it to them people down here that do my therapy. I'll tell you what, you guys will never find anybody better than girls and Mike down there. And I'll guarantee you that. Between the good Lord and down here, them gals, I'm walking. And they didn't think I was gonna walk. And I'll tell you what, I think that you guys should be pretty proud of your staff down there. And I'll tell them, when you get a little tired, they say, hey, rest a little bit, and this and that and stuff. But I'm the type of guy, I like, but it was a shame my wife had to go through all that damn traffic during tours. and everything, but we have room right here. And I'm a taxpayer, and it made me mad. So I'm here tonight to just tell you guys, I hope that never happens again. Because I'm here to tell you, whoever it was, she wouldn't take me. I had good people coming in and telling me that was good. If my blood pressure, as soon as I got to Deadwood with after the pills, they said, well, you're here at 3:30 I got there. And they said, well, it was too late to do any therapy or anything. So the next morning I got up and I walked all the way down to therapy with my walker. And I come out, and she said, well, you did all the therapy, so you gotta be tired. She said, we'll take you back in the wheelchair. I said, well, if I can walk, can I go ahead? She said, yeah. She said, you walked all the way back. She said, I don't know what everybody's problem was. But Deadwood took me. But it ain't really got no place to go but Deadwood or Hot Springs and here. But they wouldn't take me. And that pissed me off. And I think that's pretty goddamn sad. And I know a lot of people in town here, and I work with a lot of people, and they said, that was a damn dirty trick. And they said if you couldn't, they could have got you out down there and got your therapy and back a little bit. My wife could have just come into town and back 10 miles. And I think it should be addressed. And people should wake up here. Whoever's running the damn thing, I had people I had thousands of texts and everything. I had people all over hoping I could come to Newcastle. But I couldn't get any visitors because nobody would come over there. Here they would have come over there. But I'll tell you what, I'm going to, them girls down there, I'm going to tell, and I'll tell you what, I'm going to tell you one thing down there. You got a lot of other people coming in there. And can't hardly get up out of a chair or this and that and different stuff. And I see it. I've been there for ever since I come here almost a year. And I'll tell you what, I think you guys in this goddamn county, we pay taxes and I don't get no road graded, I don't get no gravel, I don't get shit. We do our own. So I'll tell you, I'm going to tell you this right now. I put a sign up at my place. I'm Crooked County because of crooks. And I tell you what, and I'm the mayor out there. And I don't get nothing. And I asked them in the meeting, I said, why don't the mayor get paid out there for some of that money that we're paying for nothing? You know, there's 30-some people out there. And they're getting nothing. But it ain't your guys' deal. But, I tell you what, it's pretty sad. I'm making me a license plate, and it's going to be just probably a joke, but I'm making one, and I'm going to send it to them and I'm going to talk to the sheriff or the highway patrol and tell them, see if I want to go. I'm going to make my license plate here for next year, but I'm staying. But not took all that aside, but you know, I think the county should put it in there and try it and anything. I bought a real wide recliner, and it's cloth. And it lays you all the way back, and you can put it on heat and it vibrates your back, you know, it massages you, and it'll tip up, and you can get right out. Why can't the county buy something like that? You know what it cost me for that? $900 and some. And I think the people can't get out of the chairs. They can't do anything. Boy, that would help people, even me. It would help me. But I'm just going to say, I told them guys down there, why don't you have something like that? I see people come in, can't hardly get out of the chair. Kip Miller can't hardly get out of the chair. He can hardly walk. And this and that would just help him get up. But $900 and some kill you guys? I mean, really? To have something down there. And people could sit there and get out and get up and get going. That's what I got home, because sometimes if I don't have arms like this, I can't get out. But that's my deal. And I've been disgusted. And I had to get off my mind tonight and everything. But as far as I know, that's my complaints. But I'll tell you what, if I had my choice and I can't, like I said, I'd give every penny to them girls down there. And Mike and them guys are just sweethearts. We laugh, we tease each other and everything, but that's about all I got to say. But I think you guys should sit down and consider the patients are alive and up and doing pretty fair. I've got a broken hip and stuff, but I wasn't hurting. And I could have went over with the ambulance. But I know the law says you gotta come to the closest hospital. That's the law, because, I mean, as far as I'm concerned, a lot of them big wheels are goofy anyway, but that's just my thing. But they could have just headed out to Rapid City, and I'd have been over there, and time the helicopter got here and everything, shit, I'd have been over the Rapid. But I know the laws, and that you gotta follow it. I'm not gonna lie to you or nobody. But I don't think you need to call a helicopter if the person's alive, and ask him, do you want the helicopter, you want to go by ambulance? Hell, I want to go by ambulance.
So in regards to we are doing a better job right now. I know we weren't doing a very good job a year ago, but we are doing a better job of getting people in.
Yeah,
And
well, I hope so.
I hope that won't happen anymore, because we are doing a better. Shane and Kathy are doing a good job of getting people in.
Yeah.
So,
Well, I mean, I'm the type of guy, if you got your full, you're full. But I mean, if you have room, you should take your people around here that are paying.
That's why we're here. That's why we pay taxes, so we have a hospital.
Yeah, well, that's right, and I like it. I mean, I like something in our town for people working, and I'd like to see our town grow a little bit, but it won't, but I'd like to. But I just, that's all I had to say. I kind of wanted your idea. What do you guys think of, I mean, just through your eyes and your thoughts, what about a little chair down there like that? Yeah, it's only $900 and some dollars, $1,000, say.
So it'd be interesting, you should ask Mike what he thinks. But I know when my husband was in physical therapy, they didn't want him to get a chair like that, because they wanted him to work hard at getting and not lose that strength in his arms. They definitely wanted him to have those arms.
Well, I talked to Mike, he didn't think it was too bad. To me, I took it, I might took it wrong too. I'm not gonna lie to you.
We do have them. We have them in our inpatients for patients who are here for their, if they're in a rehab. I mean,
I see.
Like the hospital part.
Like poor old Kip Miller, I probably don't know him a lot, but he can't hardly get out of the chair. He just struggles and fights, and he can't hardly get around or he gets in his pickup, but it takes him a while. And I just thought, if it would lean up, he could get right up and go out. That's what I'm after, to help people. That's why, I'm not for me.
Mr. Heath, thank you so much for the kind words you said about our therapy department.
Oh, they're great.
Really nice of you.
Don't ever get rid of them.
They are good folks down there.
They're good dang folks down there.
Sir, can I ask you a question?
Yeah.
When did this occur, when you were transported by helicopter? When was that?
About a year ago, May 23rd.
Thank you.
2023. Then I was in Rapid for a month, then I had to go out of there. And they had room here, so I thought, well, hell, I'll go to Newcastle. And they said, well, they wouldn't take you, they won't take you. And I said, well, why not? Why not? Nobody gave me an answer.
So just so you know, we have really looked at that process.
Okay.
And I think we are doing that really differently. But you could definitely, if you're in the hospital again, send your wife in here to the meeting or get a hold of any of us. But I think our whole process is quite a bit different now, and we're definitely trying to be here and be available for everyone here that needs, whether you need the swing bed at the hospital or the corner or whatever. So
I had to have therapy after.
Yeah, and I'm glad you have a good experience there. They are good people in therapy.
I'll tell you what, them girls and him, you can't find better people right there.
Yeah, we're blessed.
I hear a lot of people saying, and I brag on them, I'll tell people anywhere.
Yeah.
I said, you go to Newcastle, you'll get well treated.
Yeah.
tell people anywhere.
Yeah.
I said, you go to Newcastle, you'll get well treated,
Yeah.
and I mean that.
Can I ask you a couple?
Sure, go ahead.
So where were you envisioning this chair being located? Is it in the waiting room or is it within the department?
I'm thinking the park,
In the department, okay.
yeah, I'm thinking.
Okay, and on your transport, did anyone ask you if you had a preference? Whether you went by ground or?
No, nobody said a word. She just, the lady, I guess it was the nurse, I guess, I'm just thinking, because I didn't see it, I was laying on the table, so I didn't know. And she come in and said, I called the helicopter, and I heard him spoke up, said, no, cancel that thing. And I said, I'll go by ambulance, I'm all right. I mean, sure, I probably hurt a little bit, because I had a ankle, I got a
Yep.
hip, iron in there.
Oh, yeah.
Whatever they call it. But, yeah, other than that, I could have went by ambulance, I wasn't hurting or nothing, I mean, I wasn't, but the doctor did my hip and stuff that night, and he got sweating, he said, man, I had a long day and long night. It was about 2 when I got done in the morning,
Oh, yeah.
so.
I do think they've worked on some of that process we've been working on ambulance transport
Yeah.
and also a more affordable helicopter transport option as well.
Yeah.
So, but that's all stuff that's good for us to hear so that we can,
Yeah, you can work on it, I mean, you don't know, I ain't really complaining that much, but I just like to have you informed of what I'm trying to do.
yeah, thank you for coming and talking
Yeah,
to
I
us.
enjoyed it, you guys are pretty nice, just like down there.
They set a good example down there, we have to follow their example.
Yeah, you bet.
They are very good, my husband's going to therapy there too.
Oh, yeah, we have a lot of fun with, even if people come in, I don't know, hell, we're nice, you know, but, well, I'm glad for your time.
Thank you for
You know,
coming.
You're coming.
Yeah, get my chair down there now.
What color do you?
We'll have to come out with
Kind of a
light, I
nice
don't know.
green, but I don't want leather, mine's a cloth, yeah, that is nice, and it's wide Orion. Oh gee, it's a nice chair, it does about anything you want. It lays way down like a bed, I can sleep in it. So,
If we put that down there, you can't stay the night in the chair.
I try. Okay, thank you
so much
guys.
for coming.
Yeah, see, I can get out of this chair, but now if it didn't have sides on, I'd have hell of a time.
Yeah.
Well, I shouldn't cuss, but that's okay. I grew up on the farm, boy, so you gotta cuss once in a while.
You take care.
Okay, thank you, guys.
Thank you.
See, do I go with second floor, first floor?
You just
walking down the
just
hall
go
and-
straight out. Are you out front or
I'm
out?
gonna take the elevator. Oh, does this go down?
You're on the main
now?
floor, just go
Oh,
straight down the
well,
hall.
then I'm
Yep.
Yeah.
Mr. Hebe.
Yeah, Walter or Leonard? I think it's
Dave.
H-I-E-B.
H-I-E-B, he's Ava Shahid's husband's uncle.
Did we get his first name?
It was either Walter or Leonard.
I will.
I asked related if a patient is in his circumstance and has a preference, is there a process by which they can say, I really prefer to do this or that? I don't
You mean
know.
for coming into our
Well,
facility?
we're
being
for the
transported out.
ground transporter that you're.
It depends on their condition, and what we don't know is what his condition was like. We don't know what the weather was like. We don't know a whole bunch of things, whether they were available.
Right.
His wife said, I want him to go by.
I don't want to have to drive. Yeah, I would agree, it depends on a lot of conditions, and there may not have been ground ambulance available at that moment.
Right, surgery.
Yeah, it does. I'm sure with a broken hip.
Right, and some, I mean,
That was very kind,
Some-
what he
I
said.
crashed, yeah, or something.
Staff.
Yeah, they're really good people. They do a good job. And we are admitting much more as evidenced by our census right now, so.
Exactly. Okay, so now the minutes. I had a few changes, which I talked to Denise about. On the March meeting, the March 20th meeting, there's just a couple. Karen, where it talks about Carrie made a motion that twice, so it's the same right there in the chain. So I'm sure she only made one motion, just need to get rid of the other one. And then on the end, Nathan made a motion twice, and then it's the same motion, so I had her get rid of one of them. Is there anything else that you noticed on minutes? If there isn't, I entertain a motion to approve it.
Madam Chair, I move to approve.
I second.
Okay, all those in favor say aye.
Aye.
All those opposed, same. Okay, approve the minutes.
I second.
Okay, additions and changes to the agenda.
Madam Chair.
Yes.
I would like to know if my candidate that I have under my name could be moved up so that she could actually, you guys could talk to her and she could go ahead and not have to stay for a lot longer at the meeting.
Yes.
Okay.
would somebody want to stay for the whole?
Well, I know, we are very interesting, but, and so I don't know where you want to move it up to, but thank you if you consider that.
Okay, so where would you get, should we do it just right after the consent agenda or right after the finance?
Personally, I would go after the consent agenda.
Yeah, that's what I was gonna suggest, but not before, because our staff was.
Right. Okay, so,
Thank you.
yeah. And the other thing that I wanted to do,
Allison's got Tom on today.
yeah, well, she had told me, she said she's gonna be on till 6, so I don't need to make any changes.
Madam Chair, I have a change. We just need to add a foundation report, committee, foundation.
Okay.
Committee report, probably after the manor report or somewhere in there.
Yeah, so yeah, we'll do it just right after the manor.
Okay.
Madam
Thank
Chair, I
you.
have a question.
Okay.
I'm gonna have a question that I think, and I'm not sure if it needs to be added as an agenda item, or can fall under the CEO
Report.
discussion.
Mhm.
So I will ask, it's related to cell phone usage. Do we want to just make that an agenda item, or?
That's fine with me,
Okay.
that's fine.
So why don't we do it, we just want to do it right after Kathy's, right after the
That's fine.
CEO? Okay.
I have a note on here too that our Wyoming license applications need signatures tonight.
Right.
So that's for our renewals of our licenses. So the 2 board officers need to sign.
Okay, so let's just put that on the end,
Yeah.
the board executive or after
Mhm.
executive. The license.
They're the renewal of the facility licenses.
So Ben, where were you thinking your question would be?
Yeah, wherever fits.
Does that work?
Yeah, it's fine with me,
Okay,
yes.
after the CEO report.
Okay.
Okay, why are we calling that a consent agenda?
We
Usually a
always go-
consent agenda will include, some boards include their minutes, because they, hopefully everybody's read it. And they'll include this, and they'll include that, and you only vote on the consent agenda, you never visit what's in the consent agenda. So in my world, the consent agenda is not the proper term for what we're seeing here.
Well, we've changed our process this time a little bit, so whether you want to you want that stuff to be talked to you about this time, that's fine. But we moved it up into the packets so that you guys had that
Yes.
information. So that you could basically, because like the CFO report, we put it there thinking that we are gonna get a finance committee report, and that basically may cover it. You may or not decide that you agree with that, but that's something that was thought of when we were talking with Allison. And then medical staff credentialing, that's just something that you got a packet notice of them, and then later in executive session, you can look at them deeper. Okay, medical staff report, you usually didn't get the medical staff report, so you just added it to your information, and really it's an FYI, because there's not anything to act on in it. And then, quality committee report, it's really the same thing, somebody attends the two members attend the quality meeting, and they get to listen to all of the reports and everything that go out, and then they can report out to you all about the quality committee.
Now, I was gonna say, we have that on here under the consent agenda, but then we have the quality on the back page as to give the report as well.
Right.
So, you wanted both places?
Well, consent agenda is the stuff that Kim put in that has to do with patient satisfactions and anything to do with our infection rates and things like that are in there. So it seems like maybe some of you didn't see it yet. But that's what all is in there. And then it basically, if you have questions or something, we would go forward with it. But there's something that's a regular routine type of thing. And so having a meeting every time over every part of it doesn't always make sense. Now, some places will say, I want a quarterly report that's verbal, you know, like that for quality or something like that to get more into it. But this is supposed to help move your, yeah.
Just for clarification, so we're gonna look at items 1, 2, 3, and 4 and vote on those, that they're all okay, before we even hear the report on the back page? Or are we, I'm confused of what
So
we're,
the point, and we talked about this at our last
yes, we did.
meeting. That, so basically, we are supposed to be reading those before we come to the meeting.
I agree.
And then if we have questions, then we need to ask them either right now before we agree
Or
with the
pull that item
consent,
off the consent agenda.
off the consent agenda, or ask them during the finance committee report or the quality. And I'm sure, anyway, so
But
that's what.
Didn't Ben have a question that we just added to the consent agenda?
No, it wasn't added to the, just added to the agenda, not the
I'm
consent.
sorry.
I'll do the CEO report.
That's
we had
what
added.
part of my confusion maybe.
Okay.
I think,
Go ahead, Carrie.
I think Ted and I read each other's minds. My question too is, these are just the reports that we're approving as the consent agenda, is like,
Just the
Kim
reports.
usually gives a talk about what happened in quality. That will still happen. We can,
No, that's not really necessarily what would happen. You'd just be asking, you'd read your information, and if you had a question about it,
then we would
then you
make
would
a
ask a
motion to
question.
pull that off the consent
You actually
agenda.
don't have to make a
Just
motion to
ask.
pull it. You can ask questions before you go to approve the consent agenda. You can ask a question of anything in that agenda. Do you see what I'm saying? So,
Yes, but I don't think
Madam
we
Chairman.
actually.
Madam Chairman,
yes,
this is the pain in the neck substitute lawyer. Any trustee can pull any matter off of the consent agenda, and then it becomes a regular item that you can discuss. What you're approving now is just the reports that are in front of you.
right.
Just so that you've read them and seen them, and they're in your permanent records. If you want to discuss what's contained in those reports, any trustee can pull it off, and then that just becomes a regular agenda item.
Okay.
Thank you, Tom.
I was somewhat misunderstanding what we were doing, but now
Now you're
I
really
see
misunderstanding.
I'm never been a fan of consent agenda, this one, but we've talked about this last meeting.
So I would say let's try, give it some time and try, see how we, and then we can revisit it, and because we are clearly a board that likes to hear everything.
Yeah, I know.
We are.
That's all I just don't want, I find value in the quality report and value in the finance report and hearing directly from the CFO, and I find value in that. I just don't want to lose that, but I'm willing to give it a
So-
try. I feel like.
So I got a lot out of that, the quality, out of the stuff that Kim added to our SharePoint. Like,
Oh, I
I
agree.
actually feel like I
Yeah.
can, anyway.
I agree. I
And
enjoyed
think you
reading
actually
it.
probably get more.
Oh, I agree,
Yeah.
and I enjoyed reading it, and I'm glad I was able to look at it beforehand, but I don't want to give up hearing from a verbal report as well.
Okay,
Well,
well,
so I was
Okay, what were you gonna
wondering,
say,
should we just, he said we could pull anything off, so for this meeting, should we pull those 2 items off so that we can just do the consent agenda for the medical staff credentialing and medical staff report?
What was also really cool about the lower cord meet is that sophomore Adam Butler ran the 300 hurdles that day because that was Laura's signature race, and that's the signature race of the track meet, and he won it. And so it was awfully nice that we had a Newcastle athlete win the 300-meter hurdles, and he doesn't usually run them either. He usually runs the 110s and hadn't actually put a lot of effort into working on the 300s. So he was pretty proud of being able to, come out and do well and then win that race. And
that was probably right around the time we put out the story on Aiden. So knowing those 2 boys, Adam was probably a little motivated to say, "Hey, somebody look at me this week." So good. Glad to hear he was successful there.
Yeah. And the Butlers and the Cords also are good family friends. So it meant a lot to him. So that was great.
No, that's awesome.
Is that the first time someone from Newcastle's gotten it?
So for this meeting, should we pull those 2 items off so that we can just do the consent agenda for the medical staff credentialing and medical staff report?
But then if we pull it off, we don't get it. We're supposed to be experimenting on if we like the new format or not. If we pull it off, we're not really experimenting.
Well, so this didn't want the report.
I know,
I don't know what to do either. I'm trying to see how to handle this.
Well,
I'm just gonna say, I think we need to find a little happy balance here. I agree with Ted that we can't let anything slide through there where we need to address. So it is our responsibility to look.
Yes.
And look closely. But I also think it's a good idea that we kind of can slide through, get the people out quicker, not have maybe.
A midnight meeting.
Yeah, midnight meeting, exactly.
and some of that was, if we gave you more information, would you be able to do that? Because it's not just you all that are sitting here. My staff that's worked the whole day are sitting here. And so I'm trying to be a little bit sensitive to that. I'm just being honest.
I get it, Kathy. I'm sorry. I just
I don't know if it helps you, but my quality report is just a summation of my quality minutes. So I don't know.
And which you did.
And I put in that. Yeah. So I don't know if that helps.
Okay. So what would happen? What are you thinking, Nathan? I haven't heard anything.
I think we have a good plan, and it will just be a little process of trial and error, and we'll dial in what we all like.
I'll just wing it with you all. Okay.
I think as a board, we prefer just kind of winging things. And so if I understand what's being said, if we approve the consent agenda, we're really not going to discuss any of those topics much in depth.
You can ask questions from it, from your reading. You can ask in the consent.
But what we're really thinking is, say, before we come to the next meeting, we will all have read the detailed reports, and we should have our questions prepared. And so before we approve the consent agenda, that would be the time to ask any of those questions so that the staff can, everybody can go home as early as possible. Once we approve the consent agenda, then we're really we're moving on.
Yeah, we don't revisit it.
I really don't have a problem with that format. As long as we have the information well in advance, that's fine with me.
I think if you look at the reports beforehand and read them and have questions, and that's needs to be our due
How I would like to see us do it, and maybe this will work for next time, but is have the consent agenda, have the reports, And then just kind of in our minds plan on 15 minutes of back and forth with Kim and Tish about questions, and then go on from there. Is that, do you think that works, Ted?
I will try anything. I understand people need to go home, including us eventually, but staff members have had a long day already. They can sit here for another 2.5 hours waiting for us.
It's long. Yeah, okay, so now, how to move forward right now?
Motion to accept the consent agenda.
That wouldn't be very fair to ask you to do that when you don't like it at
You
all.
asked how you want to proceed. I said, do you want a motion?
Okay, so maybe the good question would be to ask if you guys haven't had an opportunity, because it's new, to read the consent stuff. If not, then we'll go through it. And then next time, try it and see if you like it.
I've read it.
I read it.
I've read most of it,
I skipped a few on the equality on those, each one.
but I was asked by Lisa.
Ben, did I hear a motion?
I was ready to make a
Okay.
Madam Chair, I move that we go ahead and accept the consent agenda as written.
What do we need to review in the med staff records?
And executive session.
We'll do that in
Executive session.
Okay,
We need a second.
yeah, so
I
yeah.
second it.
Okay, all those in favor, or any more discussion? We kind of got that out of order. Any more discussion? All those in favor say aye.
Aye.
All those opposed, the same.
Okay, I'm okay. I won't die or anything if you say nay. Okay, that's fine.
Okay, I think it passed. I'm not quite sure. I think so.
It passed, I got it down.
That was a division of a
Yeah,
house.
there was, okay. Okay, yeah.
If you don't speak, it's an automatic A, so that's the way the
Oh, I
rules
thought
are
it was a
written.
division of a house.
Okay, so.
That's your dad.
Change is hard.
I know, change is hard, but you know, we have to go through this conflict.
I said I'm willing to try.
Okay, I think you and Carrie are up.
Oh, yes, Charity, why don't you come over here, if you will? Thank you. Put that over that way. This is Charity Lincoln, and she has applied for the position of nurse practitioner. She's got a doctorate degree. You all got her application in front of you. So Charity, if you wouldn't mind, would you just tell me a little bit about yourself and your education and things you've done extra to prepare yourself for the role of market?
So I was a RN for 10 years in Sundance. Held many job titles as most nurses do in a rural health facility, where I ran the infection control department and employee health for about a decade through COVID, and then was NDS coordinator of a nursing home and got us through probably 7-8 surveys, very minimal tags. My care plans and assessments were always on point, and then I went to nurse practitioner school through a hybrid program at the University of Arizona. Graduated with my doctorates with always the intent of coming back to practice in rural health. But I did all my nurse practitioner clinical hours in the Moorcroft and Sundance clinics. And I recognized that the providers are really, you're kind of on your own in a lot of cases, and I didn't quite feel safe practicing medicine on my own at that time. So I'm in a postgraduate residency program at the VA, and I'm about 8 months done, just so I could just get a little bit more confidence in my skills caring for the veterans, because they're a lot sicker than our average population in the community. However, as I was telling Kathy, my true love is with pediatrics, in women's health. And I've been trying my whole nursing career to get back to the kids and women's health. But I've got about 120 hours of SANE training, which is sexual assault nurse examiner training. I've been through courses, 3 courses 3 times in Wyoming, which adds to the trauma-informed care that you do with women's health.
And tell me a little bit about your extra, what you were hoping to gain to be able to be ready for the work market. How many extra hours did you go?
My clinical hours, it depends with nurse practitioners, but my program wanted about 800 to 900 clinical hours, with all mine being in a rural health clinic in the local area, caring for community members. And I forgot to mention, my preceptor was Kenda Hughesby in Sundance, who has a very strong mental health background, so I'm incredibly comfortable managing ADHD meds, depression, anxiety meds, from like the teenage population into adulthood as well.
So can I ask about how young of peds are you comfortable taking care of? Like baby? Okay.
Yep, I love little kids. I'm a mom of 4, and I was camp nurse for the 4-H camp for probably about 4 years with the Weston County and Crook County 4-H groups. So I volunteered every summer being camp nurse, but babies to teenagers, very comfortable with the whole range of ages.
Can I ask a question?
Mm-hmm.
So I'm a pastor here in town.
Mm-hmm.
So it's a pretty large concern for me. What's your views on abortion? Can you advise?
I think it's women's choice, but at the same time, it is not at all within my scope of practice to do anything regarding that, other than providing basic women's health, reproductive health care, etc. The abortion topic is not really within my scope to touch on.
If a teenage girl came to you and asked your opinion, what would you say to her?
I would tell her it's something that she needs to discuss with her parents, because it's my opinion, a moral option, and it's not my real place to interject my own opinion onto a patient's.
Would you say the same thing about transgender type discussion?
I would provide competent care to the population, but once again, not my scope of practice to provide specific transgender care. But if they came into my office for like a sore throat or something like that, I'm not going to treat them.
No, I'm asking if they were asking about your opinion, would your assistance, your direction for that kind of thing?
I think culturally competent care. It's not my place necessarily in medicine to provide that care, but at the same time, it's also not my place to tell them what they feel is right or wrong.
Okay. Thank you, I do appreciate it.
You said you were an APRN and you just completed the doctorate program. So what do you tell your patients how to address you? Dr. Lindholm or Nurse Lindholm?
No, like most nurses, very informal. If we were in like a formal setting where I was presenting, like if I was being introduced in front of a class locally where they were using my professional title, I would be Dr. Lindholm. But like most nurse practitioners, I really am not that hung up on titles. And
I'm just curious.
It's a big debated topic in the medical world. Currently, when I introduce myself, it's, hi, I'm Charity. I'm the nurse practitioner that's going to do your exam. And I leave it at that. I have never once, besides outside being introduced at school, right when I graduated, it's not really that big of a thing to get hung up on.
This might not be a polling question. I'm surprised you're not just saying
So my preceptor cautioned me, she said it's a very hard transition going from nurse to provider when you've been there for so long. And that it's a lot of the nurses sometimes struggle with seeing you in a provider role as opposed to a peer role. So she kind of cautioned me if there was something local, but not so local. And I also live right on the Weston County line. I'm 20 minutes from Upton. It's closer to get to Upton for me than Sundance. So the Weston County school bus drives right by my house every morning, so I'm fairly close. It doesn't feel very far away. No, I count, especially Upton. We do a lot of business and everything in that town, so I view it as local.
Do you have questions? Thank you so much for coming.
Of course, it's to you guys.
Which we didn't actually use all of ourselves. Oh, yeah, that's right. Okay.
So I don't know, I'm Ann Slagle.
And Carrie Jones.
I'm Nathan Taylor.
Corinne West.
Ben Roberts.
Heather.
And Rick. Kathy Harshman.
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
So Charity, can I ask you a question?
Yes.
How long have you lived in Sundance? Kind of where did you grow up and those kind of things?
So I grew up in Tucson, Arizona. And then when I was about 19, I recognized I needed to get out of Tucson. And so I joined the Navy and was a helicopter mechanic. And if you remember in 2004 when the tsunami hit Indonesia, it was my helicopter squadron that did the initial 6-week relief effort. I was on the USS Lincoln doing relief work. And then I had met my husband in the Navy. And then he brought me up here in May when the weather was nice and everything was green.
Smart guy.
But then we moved shortly after my oldest daughter was born, so about 18, 19 years I've lived in Sundance.
Okay.
And I don't plan, we're stuck, roots are deep. We've got still a younger kid, so not going anywhere for at least another decade.
What do you like most about healthcare? And your job as a practitioner?
So at the VA, I got a couple months into it, and then I found my highlights of the day were the veterans that were from Weston County and Cook County coming in. And I started missing the rural health aspect and building kind of those communities that you build with your patients and everything. And I really like the, especially the pediatric side. We had some very good, Dr. Casey was one in Sundance that was greatly missed when she moved to Gillette, but building that community with the families, gaining the trust, and kind of developing that partnership with families that when they come in, they trust that you've got their best interest and kind of value your opinion, but having that collaborative agreement kind of with the patients on healthcare decisions.
Thank you very much for taking time for us.
Of course.
I really appreciate it.
Yes,
Thanks for coming and meeting us.
It's nice to meet you all.
You're welcome to stay the whole time, but really you can go home.
If you don't find this riveting.
You can take a dessert with you.
Thank you so much.
Because we'll sit here and eat them all.
Thanks.
be funny if you brought her up here in May. Yeah, smart guy. Did not bring it to January.
I can never ask for that if you don't answer those questions. I don't know the politics of the community, so this is a good thing for me because I don't know people. It's like, I don't know. So, I'm trying to find my agenda now because I scrambled.
Did we actually vote on the additions and changes to the agenda?
No, we did not.
Whoops.
No, but we can. So should we post or should we just go on like we did?
We can always catch up.
Okay, well, let's.
Madam Chairwoman, I make a motion, we accept the agenda with the changes.
I second.
All those in favor say aye.
There's a bunch of names, we're in trouble.
Okay, so we got the agenda changed. Thank you.
The second thing I wanted to mention is always a favorite topic is roof repairs. So we had some shingles that blew with the rain and the wind that was so high a few days ago. The shingles blew up and kind of off from where they're supposed to be. And rain came in and caused some rain damage in the ER in two different places. One over kind of by the medications, and then the other one was by the entryway, one of the entryways. And so when we saw that, I went ahead and called our insurance company to see if they could do a roofing estimate for us. That we're in the process of that right now, but what I do know is that if we do get a roof repaired, if we do get the roof repaired, we have a $25,000 deductible for that. So I don't know how you want to handle that, whether you want to go ahead and approve the repairs if they're needed. And if I stick to the 25,000 and that's all I need, that you could do that so that I can kind of navigate getting the roof repaired. Or if you want to come back for a special meeting, if I find out more about it. It's really up to you guys, but I know that there's potential 25,000 that we have looking at that roof. If it's more, I'd have to come back.
It doesn't seem like very long ago a roof was put on.
Yeah, and wasn't it down in the ER?
Yeah, I think that, maybe a local contractor, I don't know who to call.
No, it can't be local because they don't do the big hospital type.
No, I'm saying just for repairs.
Oh.
Just to lay the half a dozen shingles or possibly, well, I'm not a shingle expert.
Right.
Obviously, that I would like to have somebody tell me that do shingles or no shingles to say, well, this is something that you need a whole new roof on, or yeah, we can lay those back.
Well, I know you guys were going to try to lay them back. The biggest thing is they were tore up pretty bad. How much of the roof is affected, I don't know, but they said that there's grit and stuff that's coming up. And I think the last time the roof was replaced off of what my maintenance guy said is around 2016 or 17.
I think what we had happen was there was a leak.
Yeah, it was something.
I don't think it actually fixed the problem. I mean, my guess is they just.
Based on how much damage could be done, I think we just need to give her the authority to move
I
forward.
do too, because you can't play around with the leaky roof.
Especially right now where it's really bad.
And only if it gets to be bigger problem or bigger headache, and I'll send you a note to let you know what happens, but I mainly want to be able to get a roofer up here to do an assessment that knows what they're looking at. Is that okay?
That's what I would, because I can't tell you whether it needs a new roof or not. Some roofs last for 30 years, then next one gets a hailstorm in 6 weeks, you gotta be replaced again.
So would you like, would a motion to authorize Kathy to do the roof assessment and the repairs that are required be a good motion? Is that acceptable to the board?
Do you need a
I
dollar
don't,
amount?
the only
attached
reason
to
I
it?
threw out the 25,000 is that's the only solid number I have. I know that's the deductible if we had to have the whole thing done. My guess is that it would be less if they only do a portion of the roof. So if you go 25,000, and then I shouldn't go over that unless there's something I don't know about.
So, go ahead.
I'm gonna say if it's an insurance deductible, you'll pay 25,000 no matter what you do, but you might as well do the entire roof.
So, Madam Chair, I move that we authorize Kathy to repair the roof.
I second.
Madam Chair, if this is a budget item, you should probably have an amount in there. An open-ended ticket probably isn't the best idea.
Do you just want to add the 25,000 to it, Nathan, or?
So insurance, we have the deductible.
That's 25,000.
So why, could you say authorize Kathy to repair the roofs with a budget of $25,000?
I'd like to amend my motion, please. I move that we authorize Kathy to make necessary repairs to the roof with a budget up to $25,000.
Second.
Any more discussion? All those in favor say aye.
Aye.
All those opposed, say. Okay, so that motion passed. We got slightly out of order.
Yeah, we did. I see that.
We might as well just finish.
Okay. I don't know how, oh, it's because of the candidate, and then I just rolled right in. I did not follow the rules. The forensic audit, I gave you all that initial engagement letter from one company. What I wanted to come back to is, and maybe it should be talked about after or right now, and then after we talk about finances, but I really want to know whether or not we are going to move forward with that more immediate, or we're going to hold off on to our 25-26 budget if we are going to do it, mainly because I don't want to get a whole bunch of engagement letters and then we're not going to do anything for several months. So, and if I think that it's important to you all that we, or the majority of you, that we had the forensic audit. I do have caution on the fact of maybe that additional expense right now in our budget. I'm just being honest about that. I think the budget's tight.
So my thought on the topic is, for me, it's a question, it's a matter of when, not if. This does need to happen, but I am forced to prioritize patient quality and providing for our patients. We need to renew the HVAC system in the manor, which is a couple $1 million project at least. We have a new CT machine. And so at this juncture, we have all of the data. That data is not going anywhere. As far as I'm concerned, we are going to do the forensic audit. This is not the right time. It's not a wise use of our resources when we have so much deferred maintenance on essential systems in the hospital. So my thought is that we will do it. But at this point, I can't justify taking funds that could be used to repair the HVAC system in the manor or to help pay for the new CT machine and putting it towards really anything else. For me, that's my priority at this moment.
And we do have 49 residents now, so here we're using the whole area space. So. Yeah, I know.
So do we want to make it so that it's, does Kathy want to put it in the budget for the 25-26 year?
Yeah, I could do that.
That's what I was I'm sorry, Commissioner. No, I was saying, I think we should have it added to the budget as a budget item. To be obviously voted on in the future, but I agree with Nathan, it's not the right time. I do think that we can't let it fall through the cracks of the vote, that we'll need to come to that. And as long as we're not forgetting that, we push it and have it in the budget to discuss later, I think that's the way.
Madam Chair, I agree exactly with what you're saying. I'm concerned about what money we have now, but I don't want to lose thought. I would therefore move that this forensic audit item be put into the 25-26 budget to be looked at to see whether it be feasible at that time. I'm not demanding that it gets done in that time frame, but allow the board to go ahead and consider that budget, and to whether we think we can go ahead and tackle that at that time.
Is there any more discussion on that?
That's kind of a wishy-washy motion.
I can vote for that.
Okay, so no more discussion? So all those in favor say aye.
Aye.
All those opposed say. Okay, so Ben, hold your cell phone stuff, we're gonna jump back to your finance committee report.
Or were you done? Yeah, yeah, I am, okay. I am for now. I got executive committee.
Finance committee, Tish is away, so we just had her report as you guys did. We talked, Kathy led the meeting, and we talked a lot about the budget numbers. We're in agreement that we like Tish's new report, as it does a nice job of summarizing cash position, but we also understand that cash position is just one of the variables that we need to look at. We also understand that cash position is just one of the variables that we need to look at, and Kathy and the team are going to continue to work on additional reports. We had some ideas that we kicked around. Shane talked about the manor and CNAs and staffing and the increased census, and the finance committee is super excited about that. And Kathy is going to be having ongoing conversations and more in-depth look at the beginning of our finance reports, and we'll be tweaking them as we move forward. So, does that about cover everything in that?
I believe so. What do you think, Nathan?
Well, I'd like to make a couple comments. So this is the new report. So Tish asked for input, and to help you read the report, it starts with the beginning cash balance. Then it's the pluses, the minuses, and ending cash balance.
Okay, are we looking at the one that
So
says?
this report.
Fiscal cashier. Okay.
So that's the thought. I think that's most logically pleasing. We start here, the pluses, the minuses, and we end here. Okay. So what this report revealed to us is that our cash position, according to this report, I've not seen the bank statements to check the beginning and ending balance. We'll be getting that hopefully next month. It says our cash position increased approximately $600,000, but the difference in the inflows and the expenses is about a positive $300,000, meaning that our accounting system is failing to pick up quite a lot of our revenue. And so this report led us to that conclusion. And so I think we'll talk more about that in the future. But this was a good starting place. Next month, my goal is to have all of the bank statements that prove the beginning and ending cash balance. And so we'll go forward, and we're going to have more meaningful reports. But this is our first real step towards living up to our fiduciary responsibilities to ensure that, at least on the whole, we're moving in the right direction. We're not trying to accumulate money for the sake of accumulating money, but we're doing it so that we can renew all of the items in the hospital that need to be replaced in their proper cadence. And so we need to see that we're making progress towards that goal so we can continue having excellent patient care. So that's what that report is about. It's going to need a little bit of tweaking in the format. So that's kind of the new development.
So that's the differences we're seeing from the previous reporting, is what you're mentioning there. Because there was some significant differences, I thought, from previous reports.
Right.
Yeah.
So that is something that, you're right. So the March report, this is the April report. The prior month's report, the historical figures are not in agreement.
Yeah.
And so that's why I'm going to just ask, please show us the bank statement, at least for the beginning and ending balance, and then we'll firm these numbers up. Our business office is thoroughly busy in lots of different areas. And so I'm trying to find a way that we can uphold our fiduciary duty while not overly burdening a group of people that are working on very high priority tasks for us.
One of the other things that we're going to tweak on this report too is to give the board an idea of how much of these funds that we have in the CDs and stuff are designated, allocated, or obligated for a certain purpose. Like we talked last month about we received $400,000 from the state, which we know that when they process our cost report that we're going to have to give back. So that's an obligated fund that I don't want the board to think that it's, there for the spending. So things like that, we wanted to be able to give the board a true financial cash position. So
and I just
used to make decisions.
Was handed a print off bank accounts, and the total is $5.4 million. And our total ending cash on this report is $3.2 million. So this was just our first attempt at populating a new format. And clearly we need to go back and true up the numbers. But it is progress. And so this is a useful tool in allowing us to assess the quality of the accounting earnings. So this report led us to the conclusion that, we're definitely not picking up all of the transactions in our accounting system. And so that's going to help us really overhaul that system. And so it has been a useful diagnostic tool, but I do agree with Carrie that, we should not put tremendous weight in any one month's figures because we are ignoring certain things. The point of the report is just to look for a trend, over time, and that's probably its greatest use.
My thoughts are when we get to good numbers, are the numbers going to be accurate because they're going to change next month? Medicare may make a payment, somebody may make a payment, whatever. But numbers will change, but at the same time to try to get a report that at a glance, as a board member, you can look at the numbers, make a decision, but the numbers will be there. And if you need the supporting document, it may not be in that 40-page report handed out at the meeting, but that supporting document should be there, such as the bank account. It will and I'm not calling it at a glance because the person needs to look at it and study it a little bit, but it's sure a whole lot easier getting a page that this number jives this number over here, or for the month before, or the month after, that to follow as a board member to see in your mind how we are doing.
I'm looking forward to getting the one that you say, hey, the numbers are all solid and we'll stand by. I'm looking forward to it.
Yeah, I am too.
What Tish is working on, as you know, we've talked about before, making fundamental changes, like closing each month so that those numbers don't change, and working on collecting co-pays and stuff like that up front so they don't have to be tracked and billed out later. Things like that changes will be coming. But that covers it.
So I had a couple of questions on the next page, and these are just things I really was pleased with I just feel like it's an improvement, and we just keep making little steps improving, and even like you could see that on that cash flow sheet, we are improving. It's little that we're going forward as far as our money in the bank, and so that's good. And but I was just curious. So under the age trial balance, it includes, what is the government? What's the government category? Does anybody know?
That is like the VA. This is Medicare, Medicaid, VA.
Yeah, that makes sense. And then this on the stats, I was just curious.
Home health is down. They just have been going through a little slump. So I don't know, they get a lot of calls from places that aren't in our county because they don't have enough care, like in Lusk and stuff, for home health. And they would love for me to branch it out, but that's a whole big project and a whole lot of consideration and hiring people from another area. And
a lot of miles.
Yeah, it's a lot of miles, and we couldn't do it from here and pay for it. So, yeah, they are down. But I think it's just, I'm gonna go with seasonal or something.
Madam Chair, I think a lot of that too is the Advantage plans, the Medicare Advantage plans. They have such a high copay that patients can't afford to have them come in. I know. So that has some merit too.
And they're chomping down our doors right now to try to get us to sign up for Medicare Advantage programs. Yeah, so.
But that won't help imagine, will it? It won't help anybody.
You're gonna still get a copay of that now, yeah.
It just, very frustrating. Okay, is there any other questions and stuff for finance?
I just would mention that we're gonna really focus in on the copay payments and see if we can get people trained up to do that. They should really be collecting those copays up front. We're at 2%, 2.3. That's dismal.
What should our target?
50. My target would be 95, but
I think that's a charge for us right now. I think we should at least
Go
get.
a little strong at 50.
I was gonna say, we need the percentage, what percentage?
I think if we could, realistically, let's try to get them to 30% and then go from there, so.
I'd be happy with 20.
You know, though, we've gotten several checks back for $45 from the hospital. I mean, Sarah just got one today.
I've got to have a conversation with the billing office, because I heard about this a little bit before too, so I've got to talk to them, but there's a lot of work to do in the billing office. It has been for this entire time I've lived here, worked here. So, I don't have a good answer for you.
Probably the entire time you've lived here too.
Huh?
Probably the entire time you've lived here too.
Yeah, I know they struggle with it because I told you guys, I one time offered them $1,500 up front. And they wouldn't take it. So it was like, yeah. It's like, look at my card, it says I got your money. So.
Well, I waited 8 weeks for a bit too.
Right, and the other thing is that sometimes it's just knowing how to language that, and, you know, I should take them to Monument because they know how to ask right up front, they don't have any shame in it.
No,
So-
you don't go in until you're ready.
Maybe we could work on it being slightly more friendly presented than
Well,
over there.
if it's okay with you, I'd like to give them a goal of 30%.
I think that's a great start.
And then,
Short-term goal of 30, long-term goal of 50.
long-term goal,
95.
I think a long-term goal realistically is probably
Are
about
there
80.
insurance policies out there that say if you're going to the clinic every time you go, there's a $20 copay?
Yes. Yeah.
Okay, I was not familiar with that.
Yep.
Okay, that's
says-
what I'm taking that.
And a lot of them
And
say it right on your card.
It says it right on your, yeah, most of them do.
Oh, really?
They say it right
Okay.
on your card that your copay is X dollars.
Okay.
And so, you know, when you come into one of my clinics, they say, your copay is X dollars. How would you like to pay?
As far as I visited the clinic here, I don't remember them ever asking me once.
No, they don't.
No.
They don't ask.
Always get a bill later.
Or the clinic or
So
the
that's what
hospital,
we're
so
looking
far,
You know,
either
then
place.
the old thing of, you know, oh, don't worry about it, we'll send you a bill after your insurance pays. That's what we'd like to stop because
The other thing is you
it's
don't always.
inefficient and it will also help the hospital's cash position. Plus,
Our debt too, because some
Correct.
people won't pay it.
and the healthcare norm is 40% of what you bill out, you don't collect.
What's our
So-
collections number right now?
Three or something like that. This last month, we collected 2.1 million. Kind of.
I mean, obviously,
Kind of.
you know,
There's more money out there.
Right,
Yeah.
you can't do that like in the ER,
Yeah.
but you
No.
can do that on a routine office visit. And, you know, a person who knows they have to pay $1,500 when they come in for their CAT scan.
Right.
Deductibles and stuff are hard, but copays are easy, so
Yeah,
we might as well
copays are
go
easy.
with the low hanging fruit. Get used to the idea.
So I would appreciate it if you guys would tell Tish how much I like this.
Sure.
It's great. Anything
Thank you
else?
for those great questions and good discussion.
Anything else as far as finance committee goes?
And just was up from there,
On me?
Yes, you, Ben.
Okay. And this is a general question.
Gentle question.
I'm just asking because somebody asked me and I just did not know. So I do think it's something that potentially could be a problem. Is the hospital requiring the employees to have something on their cell phone that they have to use to do?
Well, they're looking at and this is, I don't think it's implemented all the way, but they're looking at an emergency management plan so that there's this alarm that goes off if there was an emergency, like a disaster plan, that they would then be notified that it's a disaster and they're supposed to come into work if they can.
So it's not timesheets or any of that kind of stuff, or, okay, all right.
That's actually a pretty normal thing to
Yes, go
have.
ahead.
ADP is down.
Multi-factor.
I think they can they, do you guys punch in and out on your cell phone?
They can.
But it's optional.
It's optional.
Okay.
Most people punch in and out on the clocks, truthfully. or the computers.
And the only reason I bring that up is I've been in another organization where this really bit us hard.
Okay.
When we started putting things on cell phone and then started requiring it, we ended up having to buy cell phones. Because it became a mandatory, if we put it there when the employee that chooses not to do it, then you end up having to buy it. So I just want to make sure we're looking at that straight.
Well, I'll make sure the person that's implementing it works on that with me, and we can make sure that that's.
As long as we're given an option, I think we're good. But
Yeah.
I just,
It's an opt-in or not opt-in, basically, well, we mandatory did it anyway.
It's tough, because I can tell you from my perspective, we always had a no cell phone policy for staff that are on the floor, but now everything, you have to use your cell phone to log into websites, and that's very hard to do because now, like my patient care protocol.
so that goes down the way of then.
It went out the window.
What if I'm an employee and says, I can't afford or I don't want to get a smartphone?
Well, they can do the multi-factor authentication on an email app as well.
Yeah, I would just ask that we keep that inside and just.
That's
a good question, actually. That's a very good point.
It's brought up, and I just want to make sure.
Yeah,
It's
no.
one of those hurdles you have to figure out.
Madam Chair,
Yeah.
one more comment from the peanut gallery. I would like you know that two judges, Judge Sharp in Cheyenne and Judge Owens in Jackson, have ruled that if you do any public business on a private cell phone, that's a public record. And when somebody sends you a public records request, somebody, hopefully not me, is going to have to go through all of that information and review it for privileged information to produce it.
So,
But this is for just a column.
I think, so this was, what they were talking about was, if
Disasters.
if a disaster, it's kind of like a beeper almost.
It sends you out, yeah, like, it sends
A
everything.
lot of hospitals with bigger budgets than you have gone to separate texting applications. So they have their personal messaging app and then a hospital texting app as well.
Okay, yeah, like you said, bigger budget.
Yeah, well, I'm sorry. I just wanted to throw that out there. I will now go back to minding my own business.
You're good.
Appreciate the information.
Thank you,
About that.
It's actually linked to the emergency, like the county emergency preparedness.
Oh, yeah.
It's something that the county's using as well as the
I'm
facility.
getting it
It's
from
just,
the county.
if we have a disaster, it goes out not only here, but to the whole county.
Yeah, you can sign up.
And, yeah, and
But it's not like a mandatory, like you have.
that is not mandatory, no. But you can opt out of it. You know, if it calls you, you can block it on your phone.
So it's kind of like an all-call that the
Yeah.
And did I see, that Wendy sent a text saying that employees, like, I sent an email saying employees can't use their phones on, like, how does that work? Like, not being able to use your phone in the hospital, and then, but still having this
Well, if you were in the hospital, you wouldn't need an emergency alert.
Alert, because you'd already know.
You'd already
Right.
know.
Yeah.
I think she meant for personal business.
I think she
Don't
was-
be like Facebooking, don't be streaming music, don't be whatever.
It was just laying down the law about being productive.
TikTok.
I know.
Yeah.
And that's fair.
That's
But
totally,
that's why I
that's
said
the
it.
problem,
Yeah.
that's the problem with the phones, is you're not being productive when you
Agree.
I
mean, like, I would like to not even turn mine on, but you need it every 2 minutes for the multi-factor authentication, so it's kind of hard. Like I was saying, it's
And
a
that's a choice
catch-22
when you get that.
because it interferes with your productivity, but then it is your productivity.
Well, the
so
other thing
it-
and I've been here before once too, being careful when somebody we think is not doing hospital business, we can't get into their phone, we can't take their phone from them, we can't, we can say, are you, and will they admit to it? But investigation gets kind of, I can't take their phone from them and say, oh yeah, you're on Facebook.
Right. The only reason they can is if I have my ER email on my phone, because I couldn't probably do my work without it. But if you have that, Wendy makes you sign a piece of paper that says that your phone may be confiscated for public records or any kind of record. So we have that policy if somebody has their mail on there. But if they're just goofing off, it's usually because we see them goofing off and they just need it.
But most people challenge will say yes, but
yeah.
In this case, somebody grabbed the phone from somebody and they
oh
said,
no, yeah.
And that ended up being a big.
Yeah,
yeah,
I would understand that too.
That's not in our culture, I hope.
Yeah, so. And that's good. And I just ask us to be careful, that's all.
Yeah, okay. Thank you for
I
those.
think that's a reminder to hurt to be heard a few times.
Crazy.
Off and on.
I did a moratorium on cell phones one time for a month. They thought they were going to die, and what if my kid has an accident? I said, well, there's a desk you can still call and all that stuff. But you know what? They started recognizing they were a better team. They were working better together and stuff, and that it was better, and that there wasn't the emergency to have that phone because of their kid, like they thought.
It's like a crutch.
Yeah, it's a crutch. And so they did get their phones back, but I said, if you start sliding again, we'll do a moratorium again.
Well, good. That's a good thing.
30 days, they thought they would die, but they didn't.
I'd love you to take my cell phone, please.
Exactly. Okay, so are we on to the quality reports? Well, that's Kim, I think. I mean,
Well, the committee report.
yeah.
She submitted the report. I think it's just if you have anything you wanted to report about from the committee, from the quality committee part. And if you're not ready, that's okay.
No,
You
I
can say-
just have foundation and quality here, so I'm looking for the right one.
You can mix it up.
What's that?
You can mix it up.
Okay. Gosh. Usually Kim talks first and then I just say if there's anything else I needed to discuss.
It was a good meeting.
It was, I made it to it.
Everybody reported on their improvement projects.
Yeah.
Yeah.
We're starting to see graphs.
Got more statistical data. The lab analyzer, I think Jim said he's about 2 to 3 weeks ahead of schedule right now, so that was a good move.
Yep.
We have a patient experience committee now, so that we can work on patient experience.
So we'll be digging into the survey results so that we're not spending all of the quality committee going over those results.
So what's the goal for the implementation date for the new Kim analyzer?
That is
It was June
7th.
June 6th. But we target the live June 6th.
They think they're gonna be 2 to 3 weeks ahead of time on it, so.
It has been running early for everything they've been doing, but he still said it June 6th. Or that's what I wrote.
So is this a question for, I think this is a question for the fundraising for the CT machine.
Oh, that's
Are
in
we
foundation.
doing- Oh, that's not.
Oh, no, that can be quality too. Yes. Yes, we are doing.
Yes, we are doing fundraising.
We are.
We'll wait till foundation.
No, that's okay. We can do that under that here too.
Whatever you want.
Kathy, do you want to talk on that or do you want me?
Well, basically the short narrative to it is that we have some people that are committed to providing some funds. We don't have the exact dollar amounts yet because we're trying not to be rude. They've said yes and we're good with that. We've got some stuff that's gone out, an ad that's already went out on social media relative to giving donations if you'd like to towards the CT, the rest of the CT cost. And I think there's going to be a gun raffle or something coming up, but there's a committee doing all of that work. So we're feeling good about it. I think we've got
What's your fundraising goal?
300 and
Yeah, it's about $300,000 now actually, because there was some additional funding. So originally it was around the 180, 200 mark, but there's some additional stuff about the room. Keisha could talk a lot more specifically
we
about.
had to get a Radex thing.
Yeah, there's a few more things about the room, getting the room ready. The architect still had to review it's a very specific fit, and then the Radex thing.
Yeah, they just need some.
There's a flyer that was sitting here on the table for us somewhere in that stuff. So those, yes, those. So that is for the board and medical staff and stuff, and then there's also one for the public. So definitely planning to try to frame those and do some fundraising at those as well. And then, I mean, I can roll this in with the foundation stuff too, but the foundation is going to also support. I think I know the amount, but I'm not 100% sure, so I'm not going to give you an exact amount, but I believe they are going to. We have a few private donors that have already committed.
And the bank, I forgot about that.
The bank is going to do a donation, and they're going to also put up for silent auction the old First State Bank signs, and apparently maybe have someone interested already in those. So we have, but I mean, it would be great. I think, I have not had a chance to look at it, but I think Charlotte put on social media today something, was it Keisha?
Yeah.
Talking about it, about the CT, and that will be fundraising and that kind of stuff for it, because we had specifically said, let's get some of this on Facebook and stuff too. So at these, if anyone can attend and talk fundraising and talk to anyone you know who might be interested, it would be great to be helpful. I think we're probably, I don't think we're probably to $100,000 yet. I do think that we're somewhere in the range of 75 to 100,000 in terms of committed donations-ish, but so we still have some work to do. So
Good stuff.
it's a start.
Maybe we can get those First State Bank signs and put them on and say deposit only.
Do we have any more questions as far as quality and foundation?
I do have a couple more things on foundation report, actually, if we're just gonna move right into that. So we do, the daddy-daughter dance is happening. It is happening, what did we say? What's the date?
What's the date, Kim?
I think it's September 7th.
September, yeah, it's in September. That's mostly, it's a little bit of a fundraiser, but mostly a community, you know, socializing thing. Shanae is, the golf tournament is happening June 7th. That is a fundraiser for the foundation, and so if anyone has golf teams that you would like to sign up, there's going to be a form in Denise's office. I think, they were going to get one for Mary to take to put up in Upton or two. Okay, yeah. Perfect. I think, they were going to get one for Mary to take to put up in Upton or two. Okay, yeah. Perfect. We had some other ideas, like potentially the gun auction, a dessert auction. We've got some other things that they might be working for. The foundation did also approve for a nurse to go through a wound care certification course, and did approve a pretty substantial scholarship request for that. So they've been very nice, very supportive, very helpful. And if anyone has, you know, requests, wants to be furthering their education and stuff, they love helping support that kind of stuff. So I think that's probably all I have for the foundation.
Good job, Green.
Yeah, sounds like been busy over there at the foundation.
Yeah.
Just nice.
Well, the one other thing is that they really are looking for some other members. There's really only 5 of us, and that includes me from the board. So, and it can be a 9-member foundation board. So they're looking, they had specifically requested, and Mary's kind of working on some people in Upton, but anyone who has interest from the community, from the staff, whatever, they would like a letter of interest explaining, why you're interested in being on there, but they definitely would like some new members. So if you have anyone that wants to help, support the foundation, support the hospital, that would be a great way to do that. And it's
right now.
Who's what?
Who's on there right now?
Mark Silty, Katie Putnam Williams, Joanna Akers, Todd Rosenbaum, is that right? And
Rosenbaum. Maybe it is.
Rosenbaum, I think.
Yeah.
And myself. So.
And I go.
Yeah,
I'm ex officio.
Yeah.
I don't vote, I just do work.
Public relations.
Yeah.
She's done good PR work every meeting. They are grateful to have her, grateful we were all smart enough to hire her.
Okay, so, any more on the foundation?
That's it.
Okay, thank you, Bree. Okay, so I wanted to, what are we doing as far as the
Well, I don't have the paper because Shane had it, and I didn't get mine back, but Shane was gonna talk about the fact that they had 49 patients. Now, I think they'll be at 50 pretty soon. What do you? Oh, so then they may be at 50.
How many rooms?
53, I think, or 50.
58
58 beds, but I know some of those rooms need some work. But we are at a really good number, so they made, it doesn't show on here exactly yet, but they made about $500,000 in 1 month for the attendance.
That's really awesome.
Did I understand Shane say tongue in cheek, because the numbers aren't, but he thought 45 was probably a good break even.
43, 45, it just depends, because then we have to start getting more staff.
Right.
So we've had to get some more staff, but we're working on the CNAs and getting, for the whole facility, we're working on CNAs. We have a hybrid program now that people can go to and do their didactics from home and then do their clinicals here and then be able to start working. How many people you have?
I have 6 currently going through it, and I have 4 that have completed it. 3 of them are coming to work for us. We're going to acute care, 1 went to the and then 1 went to home health so far. And then another doctor tomorrow that's going to go to acute care. Once we're close to finishing, she'll go to Indiana. That's others that are close to the manor. So
Congratulations, that's pretty awesome.
Yeah.
Is there ever any, like, when there isn't very many people over in acute care, do they ever do CNAs ever move over to help?
We haven't ever formed it.
I'm sure that that's a culture shift that we're gonna have to work on. So, I'll just say it that way. Yeah. Trust me, I know my nursing staff. So, so I'm really happy about that.
Right now, there's 11 over there, so they need their phone.
Right now, we're a little steep in what I call way too steep in my mind about what we have for travelers, but we're getting it taken care of, and it was really pretty ingenious to get the hybrid program going because that's really seemed to be a big target. We have a CNA analysis that we showed the financial committee. I was going to make copies of it, but Shane has it on his computer right now, and I don't know where my copy is. The thing that we found out is that the competition in the community is starting wages at $18 an hour. We started at $17 an hour. So we have an analysis that looks at 5 different ways, I think it is, that we could increase our starting wage to be competitive, and at the same time recognize all of our CNAs basically so that we don't get into compression problem. So because I don't have that to show to you, I don't know what to do about it. But this looks like my nice handwriting on there too. Terrible handwriting. So the ways that we were looking at it is some different ways where we could just across the board give everybody a 95-cent raise, and that will do what we needed to do. But that's the most expensive, which is at $79,000. What we kind of came to was a middle ground one where we would do a 3% increase and then we'd get the people that aren't to $18 to $18 and 3% for the rest of them. And we felt like that gave us enough movement on everybody to be fair. And it's a cost of $52,000 over the year. So we were hoping to be able to kind of talk to you about, we talked about whether we would try to implement this right away, especially since it's a competitive market, and I think that there's room, only because we have some positions that aren't being utilized right now, for that to be able to be competitive. We're hoping to do that, but if otherwise we were wanting to put it into our budget for next year so that we can get to that 18. But we have lost people for that difference in wage.
That would be benefits on top of that, but it's just the.
Right, that's just the benefits.
The hourly salary.
Thank you.
Hourly.
So that was another piece, and I'd asked him to do the analysis. He did a good job on it, and there's numbers in between. I think the finance committee understood our position on it and felt like they could support that decision if we decide to do that, so that we stay competitive. The 52. We both agree that we would go with the 52,000, which is more of a moderate.
So do you need us to do this?
Well, it's outside of the budget technically, so it would have to be that you would approve us moving our wages up.
Or wait 2 months to put in the budget.
Right, but you also have room, as you said.
I do, I have room because I right now don't have the CHRO and well, quite frankly, we spend $45 an hour for the CNAs that come here as travelers.
Right.
Just
as a FYI for the board, the travelers, you said
148.
I have wrote $48 an hour they start at, and that we had 178,000 in
travelers
spent on travelers this year. That's CNA
no, this month
and RNs.
This month.
But we don't pay.
I wrote annual, and I thought that was terrible.
Can I ask you go ahead.
Well, I was just gonna say, we don't pay any benefits for them though, right? So what does that equal out to when you add benefits onto the 18?
I don't know the percentage right now, but if I was going to go
double it.
That's what I'd say. So it's not that, I mean, I know it's a big difference still, but it's not as big.
So ultimately, the way I'm looking at this proposal, I think our residents probably feel more connected when we have people that work for us. I'm sure the travelers, a lot of them are nice people, but I think they appreciate that personal connection and building that relationship, especially because the care is sensitive and baths and so forth. Ultimately, I think Kathy is on the right track because I think it can be mutually beneficial. I think we may end up actually saving, and then we're improving the quality of life for our valued employees, and it's better for our residents. And so I see this as a very mutually beneficial decision. I think Kathy's on the right track, and my input was there's not a huge cost difference between all of the well thought out plans, and I'm content for Kathy and her team to make whatever decision they think is best.
Do we have additional expenses for housing that travel?
We do.
So is
that more than the 178?
Yeah. Well, that 178. Well, actually, the housing is
of care. That
part of it. They're expensive. That's what I meant to
Yeah,
say.
but our residents are. They need the stability of our own staff, and the CNAs are our backbone. It's right for us to invest in them.
Our staff needs the stability of their own staff. We've got people that work there 33 years as a CNA. That's dedicated to the residents. That's why they're there. I don't want to lose any of them because of this.
Yeah, especially not for $1 an hour.
So we're comparing apples to apples. I have no problem with what we're discussing. I think it would be great. But we give health insurance and things like that.
Yes.
What do they do in our competition as far as so that we can think about apples to apples when we're looking at salaries? Because you've got to include benefits.
I don't know that answer, and I took a chance asking what they were paying because you know sometimes they won't tell you that, and in fact
I know
they said they were
offer benefits because years before I was going to move here, and they were asking me if I wanted to work there as an RN, and the RN job at least did offer benefits, so they offer something.
But
that
it's
was
changed
or
ownership a couple times maybe.
Yeah, well, I mean that's true, possibly.
Yeah. I don't know what.
I don't even. That's not recent, but I know that's what I did.
It's just always something that when you talk salary, I like to include everything, so you talk the same.
I'm guessing they include some sort of health care.
I'm listening. I can bring it back next month, but I want to be able to
attract talent and get them in here, so.
I would too. I would hope that we're compatible in benefits, maybe even, I'm hoping that we're better in benefits, which would add a plus.
I'm thinking, yes, because we're bigger, but.
So Kathy, would you like a motion?
I would.
Okay. Madam Chair, I move that we authorize Kathy to make the choice she believes is in the best interest of our facility, and would also authorize the funding necessary.
From the analysis sheet, right?
Right.
Okay.
Okay, so that was the limit on what she.
Do we want that, or do we want to just say, you authorize her to move the?
Well, he said, it didn't have a dollar amount.
It's just on the analysis sheet, which we'll put in the minutes. And so, yeah, if that works.
Sure. Sorry. Probably slightly improvement. No one objects.
Sure.
So, I move we authorize Kathy to choose the option of the various options that have been presented to the board. Whatever she thinks is best to achieve all of the goals that we need to achieve.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
Whatever she thinks is best to achieve all of the goals that we need to achieve. I also authorize her to spend that amount for whichever plan she chooses.
Okay, I'll second.
All those in favor say aye. All those opposed, the same. That motion is passed.
And are you okay with it? Because we can put the maximum amount on there. Because I see you looking.
We didn't even say what we were adjusting.
Right.
So it doesn't even say CNA in the.
It didn't feel quite specific enough for me. It's not really the money so much, it's just the, and so anyway, I was just trying to figure out how.
We didn't have discussion, but at the same time, we did vote on it.
So I think it's a moot point. It's fine, but.
I hopefully we all understand.
I think we all
we
understood.
did.
I was just thinking about the minutes is what.
But I think you're right to clear the motion up, but.
Could
I don't
we,
know.
in the minutes, could we just make the heading CNA wage scale so that
Yeah,
the
we
motion
can do
makes
that.
sense?
That's a good
Is
idea.
that,
Yeah.
is that?
Do you have that, Dennis? I will get it. I have most of it. I will listen
Yeah, a
to it
little,
again.
little extra information for,
That's all I was thinking about.
I think we all understand real well, but they may not understand 3 years from now what we did.
You're right, yes. Okay, so the next thing I want to set up, to look at our calendars and figure out a day when we can work on bylaws, or an afternoon, when we can work, a time frame when we can work on bylaws. But I'm guessing we'll need 2.
March 24th, 2052.
That doesn't really work.
Me too.
And Allison asked that we would kind of figure out 2 possibilities since she wasn't here. Because we'll need her.
What are you thinking approximately?
Well, I thought, so if we're having another training in May, I honestly thought that in June would be better, so that just because time, if we're spending another 4 hours on strategic plan in May, I think that it would be better to plan in June.
And you said earlier, if I was understanding, you want just a 4 or 5 hours.
That's where we can
away
just
from the meeting
focus
so that we
on
can focus on
bylaws.
this.
Yeah. And
When's the next board meeting?
so the next board meeting is May 22nd.
Oh, it is the 20th.
And we have training from 1 to 4, or till 5.
I
That's
saw
what
it
she
on
said.
the 15th.
Yeah, we changed it with the 15th to change that. And so I mean, we could do it earlier on, before the June meeting too.
So the June
But it
meeting
just
will be
seems
June
like-
19th, correct?
That's
Is
what,
that?
that's what I'm guessing.
It is. That's the third Thursday.
So,
Madam Chair, if it means anything, Allison is available June 9th, 11th, 13th, and 16th right now.
okay, repeat that for me, Tom. June 9th,
11th,
11th.
13th, and 16th.
Okay. Okay. Thank you for that input.
So remember to have that work ready for us to know.
It's not here the 13th.
Why can't you just spill
You
the
can't do it on
water?
the
And, yeah, it'd be borderline on the 16th too. Our middle son's getting married in Montana on the 14th, so.
Oh, you can't.
We're
do it
gonna
on-
be,
Yeah.
yeah.
And you wanted to attend?
Well, I mean, if you want to call him and.
No, I don't.
You can't.
No, yeah, I don't.
So 9th and 11th?
All right, works for me.
Is this May?
June.
June.
You did say you wanted it in June, right?
I did.
That
That
baby
is,
just don't know when.
the 9th is my daughter's birthday, so, but I could do it as long as like, I would rather do it
11th?
the 11th.
What time of the day are we gonna,
For,
what evening or whatever, right?
yeah. So Ted, kind of tell us what. Oh, Kathy.
I got a conference, yeah.
Oh, I was gonna say, we're leaving the morning of the 12th fairly early to drive all the way to Bozeman too, so I don't
So
want to
well,
be lazy
let's-
11.
Thank you for remembering that.
So if we did it on the 9th, like,
Kathy's gone.
you're gone the 9th and the 11th.
I mean, you guys can do it without me if you want to.
No, we have to allow us without you, so I don't want to.
Okay.
I'm trying to read this, Madam Chair.
Okay, go ahead.
Election officers.
Yes, that's
in
next
May.
Election of officers is May.
It is.
And it's, well, I was just trying to confirm so that
Right.
whatever we do, we leave time for,
Right, I don't think hopefully we can just work on hopefully the election of so the election of officers will happen before we work on bylaws.
Madam Chairman, Allison also has time the afternoon of the 2nd and the 3rd.
Second, third.
In the afternoon.
Okay.
the first meeting of the district in May.
Right,
So
yeah.
it'd be our normal Thursday
So our
meeting.
normal Thursday
Okay.
meeting.
Okay.
in May,
I
we'll
just
have
want to
that.
confirm.
Yeah.
Second one.
So the second or the third? Does anybody have problems on those days?
Third would depend on time.
Yeah, the 3rd I have a meeting at 5, but I'm available before then.
The third. So what about the second? So
Second works for me, anytime.
okay, so somebody tell me time for the second. Where are we gonna do this? Here or somewhere else?
Yeah, we'll do it here. If, I don't think there's much in the way of meeting on, if it's on the 2nd, there's hardly any meetings in here. If it's on the 3rd, there's one meeting, but we can always go downstairs too.
And he said Allison has the afternoon.
On the 2nd, 3rd.
On the second and third. So should we go for the from 1 to 5 on June 2nd? Is that asking too much?
Works for me.
Okay, Tom, so do you mind telling Allison that it's 1 to 5, June 2nd?
I will let her know.
Okay, we'll talk to her too, but just put it on our calendar. She'll be like, what?
So can I ask, we have both, the boardroom is available and downstairs is available, which would you prefer?
Yeah, if this is available, you can use this up here.
This is a little more comfortable room and easier to talk to each other.
Let's see if I can hear a little better.
Yes.
Yes. So,
Okay.
Board.
Yeah, boarded. What section are you guys gonna work on?
I would just leave it where we left off.
What do you think? You're thinking something, Carrie?
I'm thinking that if we're gonna be here for 5 hours, we better work on the whole darn thing and be done with it.
Well, it's just 4 hours, but I kind of agree with you.
Well, if if we work on it for 4 hours and not done, we'll just plan another meeting. But I agree with it, 4 hours, we may have it done in 4 hours.
So, and then,
I mean, that was the whole point. That's why you guys didn't want to do it in 1 hour
pieces,
blocks, right?
right.
You just wanted to do one and knock it out, so we might as well just
If
come
we
prepared
don't
to
get
discuss
it,
the whole thing.
my opinion is if we don't get it, we just have another, or add time to it another time.
And then the plan would be to bring all of our planned revisions to the next public meeting.
And
So that the whole community knows, right, present it, and then wait another month before we actually approve it. That's kind of our general plan, right? So we all have plenty of time to think and let the community give us feedback. Is that a rough outline?
That sounds good.
Tony sent me two different bylaws. One was really short. It was really fun. It was so short. I don't know whether that's good or bad. Do you guys want me to send those on to you? I'd have to look at.
I would like.
I'd like to see in comparison and just other ideas.
Okay.
How stuff's worded, and I think that's
Yeah,
very helpful.
Different wording could be,
Yeah. Okay.
if they can word the paragraph clearer than what we have, it might be.
Maybe we can go back, tack her down to one page and be done.
You guys can't, I
You're correct, but we could maybe make it a little more.
We can make it an effort.
Okay, I will get those sent out to you guys and,
Check for you, dear, but you can't.
yeah, I'll try. Okay, is there anything else? So I need to, basically, these are the
Licensures for the
Yeah.
facility. So it's for the home health, the nursing home, and the hospital.
And do I just pass them around so people can look at them and then sign them?
If you want to, but all it is a renewal and a license fee, so it's like, it's an application. It's an application. You have to reapply every,
Do you need a motion to authorize the board's signature on the facility applications?
I think you could do that if you want to, just to be safe, but truthfully, it's just that they want your signatures, yeah, 2 officers' signatures.
So Mary and I, or Carrie and I?
Yeah, last year it was Carrie.
Madam Chair, I move that we have the chairman and vice chairman sign that.
Well, we don't have a vice chair.
That's chairman and treasurer.
The secretary.
Sorry,
is the
secretary.
secretary.
Okay, you're right.
Okay.
I don't know where I was going with that, but that you're correct.
Oh, is she?
I think so.
The chair and secretary sign those license renewal forms from the city of Wyoming.
I'll second.
The city of Wyoming for the hospital, the manor, and
Home health. Okay, I'll second. Okay, all those in favor, any more discussion? All those in favor say aye. Aye. All those opposed say.
Because then we wouldn't have a license and we wouldn't have something to do.
We all be on this job.
Just like that.
Oh, that'd be bad. Okay, so. Are we ready? Yeah. Is there anything else?
No, they each got, the nursing home is like $15,000 and the hospital's $500 and home health is like $150 license, yeah.
Great. You can second that
Yeah.
motion.
Yeah.
Oh, did I say 15,000?
You did say 15,000.
No, that would be other things, not that.
So then I went to, then you said 500 and I'm like.
Sounds
like a steak to me.
Okay.
I had a Freudian slip of, that's all I've been doing is looking at my
So how much is it actually?
1,500, 500, and
150, I think it is.
Okay, and so then can we just, take a quick break and then move into executive session when we come back? Yes. So let's give ourselves 5-10 minutes and we'll be back. Let's see if I can start. We'll make a motion.
So Walter, we usually go into executive session and then take a break. We didn't.
Put it in the May. But it is in Castle.
Are we ready for the motion? Yeah, you're right.
Can I make a request? I think it works better for Walter,
Don't worry about me.
for everybody, if we go into executive session and then take a break. But just for next time, maybe, if, I didn't
So
think
we
I
have
would.
to figure out how we manage it because, so it is nicer for Walter. That's what it's nicer for.
Don't worry about me.
Okay, but then we have the problem of if we.
Then we're in executive, then we want to leave
We're
and
out
go out.
talking to people
Yeah.
out in the hall and we're in executive session, so it's,
Okay.
it would be easier to do it your way, but
Can I make the motion, are we ready?
yes.
Madam Chair, I make the motion we move into executive session under Wyoming State Code 16-4-4-405A2 to consider the employment right to practice or dismissal of a public officer, professional, personal employee. 9, to consider or receive any information classified or confidential by law, including attorney-client privileged communications, quality information, and trade secrets. And 10, to consider accepting or tendering offers concerning wages, salaries, benefits, and terms of employment during all negotiations.
I'll second. All those in favor say aye.
Aye.
All those opposed, the same. Okay, we are now, it is 8:35 and we are in executive session.